So baby CPAP, this is our setup for the baby CPAP. This flow meter over here is for nasal cannula only. Don't use it for the CPAP. This only goes up to 3.5 liters. This flow meter over here on this side is the one that will be used for the CPAP, and it is always set to 8 liters per minute. Baby CPAP is always on 8. Your FiO2 is adjusted by the blender, and you'll use this oxygen analyzer to determine your FiO2. This is the number we want to chart, whatever this says. If it says 20.7, I would chart 21. If it says 22.2, I would say 22. So I would just round, but chart this number. There's a little sign on all the setups that will say the RT phone number and then the time of care. So write your number and what time you're going to be back to see the baby. On this, if you need to make a plan with the nurse, or if there's already a time written up here, confirm with the nurse what time they're going to want you to come. We only have to see these babies every 12 hours for the first 24 hours, and then it becomes every 6 hours after that to look at skin. The nurses will probably want us to come more often, and we have told them that we will come more often, but we didn't want to confuse them with the times. So if they say, I need you to come at 3 o'clock to help me do care for the baby, they might want us just to come, and they might want to do skin check, so we might have to hold the T-piece mask on the baby while they do skin checks throughout, the head, take the bonnet off and everything. So this also has some cute little tips on it. Flow meter always set to 8. The FiO2 is adjusted and measured on the analyzer. The CPAP dial is set to the CPAP level on the top of the bottle, which I will show you in just a minute. To add water to the bottle, use a syringe through the white cap, which I'll show you in a minute. If there's no bubbling, which is going to be the most common thing that's going to happen, baby's going to desat and there's going to be no bubbling. Check for leaks. That's the first thing. Is the baby have an open mouth? Do you have a poor seal around your mask or your prongs? And then if that's not the problem, then work your way back from the baby all the way back to the machine, looking for anything to be unplugged or a cap that's missing or something like that. So there's our little sheet.
I have a question. I'm interrupting.
No, go ahead.
About the 8
Yes.
liters per minute. Why
Yes.
did we decide to go
8
with
liters
8?
per minute is what the manufacturer recommends to guarantee that the baby is getting the set level of CPAP.
I see.
Okay, so this is the bubble bottle on the bottom here, and it does have to be plugged into the heater in the yellow cord. The CPAP does have to be set to your level on top of the bottle. As you set your CPAP, so like a level 2, you can see the column is just barely down into the water level. As you advance CPAP 3, 4, 5, 6, 7, 8, the column goes down farther in. So this is just to kind of show you in your mind that a CPAP of 8 is going to take a lot more force, a lot more pressure to overcome that back pressure. And we will always start out on 5, CPAP of 5, but we can advance to 6 or 7. If we have a baby that's on 8, we're going to prepare to intubate that baby. This is the little white cap, which can also be a source of leak. So if you do want to add or remove water, there's a little straw down in this bottle that you can add or remove water with a slip tip syringe through this. And we will keep a syringe with all of these setups so that we have that. The heater is our usual heater, which we're going to set on 36 or 37 depending on the baby. We want to make sure that your water bottles are always below the infant. So if you have an infant whose maybe mom is going to take out and do skin to skin and she's laid back in a recliner, you want to make sure that your water bottles are always below the baby. If not, that can cause water to backflow into the baby, and you don't want to drown your little baby that's already having lung problems. So our heater, we always want to keep 36, 37. We want to make sure we keep right in the middle of the drops or the sun. And I can plug this heater in after we go over the whole setup and all the pieces and kind of give you guys a little demonstration on the heater. You want to try to keep it in the middle because if you make it too dry, that can actually, or too wet, that can actually change the temperature that the baby is getting. So it says that they're getting 36 degrees, but they might not be getting 36. They might be getting more or less depending on how it's set. It is still our responsibility to change the heater water bottle. We can use the little ones, especially for baby CPAP, because we don't know how long these kids are going to be on CPAP. Hopefully a couple hours, maybe 1 or 2 days. If we have somebody, a baby that we're keeping for a week or longer on CPAP, then we will probably be transferring that baby. There might be other things going on that we can't take care of here, so they might need higher level of care. As always, just always watch for disconnects on the heater cords, and this has a lot of working pieces. So when you get the CPAP, there is going to be step-by-step instructions on the neonatal continuous positive airway pressure guideline. This is step-by-step. It's in policy stat. It has everything from how to set up the equipment before it's used, how to test it, how to refill it, how to do skin care for this baby, what the nurses are going to do, what we're going to do. It has a nice little picture here to talk about the skin and how you should be fitting the prongs and the masks for these kiddos. So it's quite lengthy, but it is step by step. It's like Amelia Bedelia. So everything, if it says do this exactly, it means exact, like it's very, very plain and clear. So we will have that. We will also have this reference document. This is mostly for the physicians. This tells us when to turn things up and down, what to titrate when, what to do if the baby seems to be getting better, what to do if the baby seems to be getting worse. We will do this all basically based on physician order. It's not just an order protocol where we just do what we don't have a set guideline of we do what we do. All of this is physician driven. We do have to have an order to change the CPAP pressure. The nurses will not be changing the CPAP pressure. They will be calling you and saying, Dr. Seymour wants to go from 7 to 6 on this kid, or Dr. Seymour wants to go from 5 to 7 CPAP pressure on this kid. The nurses will be weaning the FiO2 kind of as they go along, up or down. So that is something that they will be doing, which is not different than current practice. Currently we do CPAP for babies. We just stand there and hold the mask on. And anybody who's had a kid on CPAP waiting for flight to arrive, holding that mask on a baby for several hours is pretty nerve-wracking. This will allow us to be able to keep babies a little bit longer, or keep babies comfortable before they transport because they have other issues going on. So when you get the setup, it's going to have a light blue bag covering over top of it. The light blue bags are going to be kept on the baby CPAP cart. It will come with this is a ventilator circuit, which is found on the CPAP cart, CPAP supply cart in the clean room. And it will have the Y already on it. This will stay on it. So normally when we have a ventilator, we have this, we have the temperature probe plugged in right here. But we don't utilize this piece right here when we have a ventilated baby. So this is what's different about it being a baby CPAP, is we will utilize this extension tubing on the blue side, which just allows us to have our heater probe a little bit farther back away from the baby, so that we won't get so many alarms with the warmer actually warming up the heater probe wire and causing erroneous alarms. So we will basically, to start the baby on CPAP, you'll take the Y off and you will select whatever size prongs you want for the baby. We do have a sizer that comes with the trunks for the masks, so we'll talk about that in just a minute. But our plan is to use these sizers, so we want to keep these for like the first year. Every time we open a package that has one of these in it, we want to keep them. We can wipe them down and reuse them. What we'll do is we will have the prongs size correlate with the size of prongs that we have. So if, say, you have this size baby and this is the prongs that you want to use in your little nose, and you can kind of hold it up there and see, you can say, oh, I want this size, which is a size number 2. So then you know you can get this guy, and you can say, oh, I want size 2. This is a 1. So this is a 3. We have 0 through 5 on the prongs, so we have tons of different sizes. 0 is going to be for teeny tiny little babies. We're mostly going to use 1, 2, or 3. We will have a size 4, which is going to be for like your really big babies. Maybe someone a little bit term, or maybe even over term, meconium baby that just needs some CPAP because they had a really rough start. So you'll size your prongs, and your nurse will be CPAPing the baby with the little mask. You'll get all your stuff ready. Inside the package comes a hat and some Velcro. So what I did was I cut the Velcro directly in half. It has sticky stuff on each side, and I took the hook side of the Velcro and I attached the hook side to my hat already right here on my baby. So I attached the hook side, and then I took the loop side, and I just have that to help secure the circuit. So this is what your baby's going to look like. Then you're going to get your prongs, and you're going to put your prongs in on your baby. And this is kind of how not to fit your prongs, because this mannequin is not a true to life newborn size baby. So you want your nares to be filled 75 to 80% of the way. You want to make sure that you have a seal. Not any. You don't want the prongs to occlude the nares so that it causes pressure, but you do want there to be a good seal. So you just make sure that you have a good enough seal. You attach your prongs onto your circuit. It does not matter which side is which. It doesn't matter if you put the white on this side and the blue over here, or vice versa. It does not matter. What does matter is this little white cap. So when you get your prongs, when they come out of the package, they will not have this white cap on it. We do have white caps. They will be included with the setup, along with several sizes of prongs and some of these things called the sticky whiskers. So the cap goes on here. This hole is actually was designed to be where a pressure manometer could go. We're using a lure lock, so you basically just screw it in and screw it out. Make sure that this hole stays plugged. This is not an exhalation port. This is a plug. And this is going to come in very handy very shortly. Okay, so you have your prongs. You're getting them on the baby. You want to use a sticky whisker. And this mustache piece up top goes on the baby's skin, and it has little micro hooks on it. They're not rough at all. They don't feel like hooks at all. And then these strips down here, there's actually 2 strips in the package. They can go onto the prongs, either one on each side of the prongs, or you can wrap a spiral style around the prongs to help secure it in place. So you'll have the mustache sticky whiskers will be on the kid. The loop part of the sticky whiskers will be on the prongs. And then basically, as you fit your prongs into your infant, you'll make sure that your prongs are in, and you just barely touch it down. That will keep, the sticky whiskers will keep it kind of in place. The other piece that you have is the Velcro hat, and you do want to make sure that you don't have really anything touching the infant except for the prongs. Then you take your Velcro strips, your hooks, your loops, and you attach it around your circuit. And at this point, the baby should be bubbling. You should instantly hear, once you make that seal, you should hear the bubbling. Should be vigorous. You'll be able to see it down in the bottle. And that's it. Your baby is on CPAP. You can adjust it. This does turn, so you can adjust it up or down, whichever way you feel that the baby needs it. You do need to be careful that these don't poke in the eyes. You want to make sure that you're not causing any pressure on this little one at all. Okay, so the circuit will be resting on either the side of the warmer or through the hole in the giraffe. The giraffe has a hole at the top. The giraffe is like the incubator type warmer. And that's it. Hopefully we will be able to CPAP this baby with the prongs and not need to go to a mask. There is a considerable price difference between the prongs and the mask. And so as an organization, we're asking that we just use the prongs to start with. There may be times in kids that you can't use the prongs with, they don't tolerate the prongs, or say they have an anatomy issue in their nose and maybe they need the mask. I'm sure we're gonna come across something like that. We can absolutely switch to the mask. So say you have this kid and you're inheriting this kid from the previous shift. They've been on the prongs and they've been doing okay, but the nurse called you and says she thinks that the shift before you tried the smaller prongs and they weren't enough to make a seal, but these prongs are really kind of irritating the kid and making a pressure sore, she thinks. So can you come up and switch? Absolutely, we're gonna come up and switch. First thing that we wanna do is take the baby off of this CPAP and just T-piece them. So you just have the nurse stand there and hold the little mask on, watch the SATs, match your CPAP level to whatever you're on. So if you're on 70% and 7 CPAP and you want to try to switch you're trying to switch to your mask, then you want to match that on your T-piece so that your pressure and FiO2 stays the same. When you take this off of the baby, it's pretty simple. Take off this hat, because this hat is used for the prongs. Then you can take off the prongs. Now, so the nurse is CPAPing the baby with the mask, and then you can get out the other setup, which is the flexi trunks. So flexi trunks come in 2 different sizes. The size difference is how long this rigid part is. So this is a 100 millimeter size, and this is a 70 millimeter size. So you can see this one is much smaller. What you actually want the rigidness for is you want the rigidness to be able to go from the baby's nose to the forehead. And as you can see, I mean, 100 would be probably okay for me. So it's gonna be a big baby that this 100 is gonna fit. Most of the babies we're gonna use, this 70 is probably gonna be about the right size. The mannequin baby, I don't think either one of them fits the mannequin baby. So we just got lucky with that. Let's see, we got to attach. Again, it doesn't matter which one goes to which hose, top one, bottom one, doesn't matter. Then you have this little foam pad. So the foam pad has little pieces that can detach off. Anytime you're doing anything with this baby, changing anything out from smaller to larger size or the foam pads, don't throw any of the pieces away. Please keep them, because what's going to happen is right now you take off a piece of foam and you keep the foam. 2 days from now, when Yulia comes in and takes care of this kid, she's going to think, it's kind of getting a little bit red. Maybe I should put that extra piece of foam back in. So she puts the foam back in. So what this does, this flexi trunk, is basically it just keeps everything straight. But by doing that, it can help reduce pressure. So if your trunk is too long and it's too heavy, you're going to get pressure on the bridge of the nose. If your trunk is too short, or maybe it's you can get pressure under the baby's like on the baby's lip. So it's mostly just for pressure. These babies have several different sizes of hats that go with these trunks. Every one of the hats that go with the trunk is actually too small for our mannequin. So when you get into the bigger kids, you're gonna get this little piece of headgear. The headgear is great, it's super stretchy. That's a plus, but that's also a downfall. Because it's super stretchy, sometimes you're stretching and stretching and stretching and stretching to try to get it lined out for the baby. Okay, so you put the headgear on. In the meantime, the nurse is still giving the baby a little bit of CPAP through the T-piece. And you want to make sure your pieces are lined out for you. Okay. Okay, so this top strap goes around the top of the baby's head, and like I said, this piece is super stretchy, so you have to make sure it's stretched enough, but it's not stretched too much. You also want to line up and make sure you get a good seal on your mask. That can be a good point of leak for you. And then this piece goes up over top of the foam and then attaches back onto the Velcro.
Interesting.
Okay. Now to actually secure the mask, you have these little side pieces. And it helps a lot if you're not having to hold the circuit, if you have some place that you can put the circuit like up on the edge. Okay, so you have a little hook here on the side. You just hook this piece in, hook the other side in. Oops. Hang on, I lost my mask.
Hold it for her.
I've used this mask. This is like my 5th demonstration now, so this thing's been taken on and put off multiple times by each group of people.
So the maker guarantees that there will be cpap effect on those nasal prongs.
Yes.
How much of diameter in the nostrils do we have
75 to 80%.
Okay.
Okay, so, and then ideally you would close both of these at the same time.
I asked because when I was there, for UW it didn't work.
The prongs.
Yes,
Yeah.
and they were doing the different size of the mask.
Yeah.
So they were changing, I don't remember what was the interval between the masks, but they were changing from bigger size to the smaller to prevent the pressure source.
So ideally we won't have kids on CPAP for longer than 24 hours. This is just kind of a Band-Aid. And we want to try to use the prongs first. If you can't, if you have a kid that's just not gonna tolerate the prongs or physically doesn't match the prongs, then we can absolutely, and you can do that. You can use a smaller mask and a bigger mask if you're trying
What's
to.
the price difference between prongs and
About
masks?
5 times as much
Wow,
for the mask versus for the prongs.
that's a big difference.
Yeah. And so basically that's it. You just have these little hooks that you hook it in, and then it sticks to the Velcro. Then of course you just want to make sure that you're not getting anything in the baby's eyes, that the skin looks good, you have a good enough seal. Is the baby bubbling? And
How
that's
do
it.
we choose the prawns, the size of prawns?
With the sizer.
So whatever is the, whatever, we go by mask, right?
So yes, well no, you go by these holes at the top, the little holes for the
you
prongs.
kind of eyeball
It'll say like I'll have a comparison. So if your kid fits a 40-30, that's a size number 2. If your kid fits a 30-20, that's a size 1.
No, but what I mean is like we're just looking at the dot and then we're looking at the nose and the nostrils and eyeball it, or
Well, you
Or we
can
just
hold
go-
it up there as
okay.
best you can and kind of see where this kid is going to be. There's little
Okay.
dotted lines that go all the way up to the top. So you can basically hold it up there and
Okay.
see.
What do those big
Which
dots
one?
mean?
What are those big what mean?
Dots at the
This is small,
this
medium.
one's
These
not
are for bigger prongs.
I see. Okay.
And the mask is the same. You use that chart for the
Yep,
mask.
you
Yeah.
use this chart for the mask, so
Yeah,
small,
I know
medium,
the
large,
chart
extra
for
large.
the mask.
So when you get one, you open it up and you're like, I think he's a medium. You can always have the nurse hold hold the T-piece up for a minute to really size the baby, and then be like, no, he's gonna be an extra large, put that back down, he's not large. Yeah. So keep these. Billing, we will do billing for these kiddos. It is a cpap charge, so make sure that we are charging for cpap at setup. We don't charge anything at this time for the circuit or the masks or the trunks or the prongs, any of that stuff. We just charge for the cpap setup. Night shift will charge every night for cpap that the kiddo's on there. We have a laminated cheat sheet on how to order it, just in case you should get in a pinch and need to be the one placing the order. We also have a cheat sheet on our new flow sheet, which is called Neo CPAP. So we have Neo CPAP. You'll have to wrench it in the first time you use it, but once you wrench it in, it should be there on all your patients. And it will just have the Neo CPAP stuff. So this is all you need to chart for the baby CPAP, and then just make sure that you charge. There's also, on the overview summary page, there will also be a little section which basically says, this is what your baby's on. Some people do look at that, the providers do look at it, and as long as you've charted it on the Neo CPAP sheet, it should be on there. There's one other thing. When you have a baby on the prongs, and you're trying to listen to their breath sounds, all you're gonna hear is just the bubbling. You're gonna be like, I can't hear a thing on this baby. You can take this little white cap off. I would get your stethoscope in place, take the cap off, listen, put the cap right back on. Make sure that the cap stays on, because while the cap is off, you do break the circuit, right? There is no CPAP getting to the baby.
What is that outlet for?
This is originally for a pressure manometer.
Okay, and that's it?
And that's it. Yeah, but we decided as an organization we don't want to do the pressure manometer because we don't really care if it's 5.2 or 5.0. If the baby needs more pressure, we're going to go up. If they need less, we're going to go down.
Okay. Sounds good.
Okay. I think that's it. This is rolling out right now as we speak. So they could, if they wanted to deliver a 32-week-old baby today, we would deliver them. And if they needed CPAP, we would be called to go ahead and set this up. There is one baby CPAP which is completely ready to go while we're doing the training. It's completely ready and it's in our clean room, like I said, with the light blue bag over it. We do have 3 of these ready right now. I do have the capability to add 2 more complete setups. We hadn't done that because we were trying to save a high flow setup for COVID as COVID got worse. So now that COVID is not as peaked as it was, we can probably set them back for the baby CPAP. One other thing is we did ask that as the baby stabilizes, that we turn off this O2 analyzer just to save the battery and the O2 cell.
How do you charge the
The
analyzer?
It's a battery. It runs on a battery, and you shouldn't have to change the battery. The battery is supposed to last for like 2 years. So we'll have Biomed come and calibrate like yearly and do the battery checks and stuff.
So when do you determine if you're going to use the bubble or you're going to use a heated high flow? What's the differentiation?
The physician will decide whether they want to use CPAP or high flow.
But so they're not going to ask for our recommendations, and I'm like, I don't know why.
Okay. No, they're not going to ask us. They already know kind of if they.
Okay, yeah.
They may start out on high flow and then decide they want to go to CPAP. They may start out on CPAP and then decide they want to go to high flow. At which time we have not. We haven't decided for sure how we're going to switch from a bubble CPAP to a high flow. The NICU RTs that we have on staff right now that work NICUs at other places have said, oh, it's totally, we can do it. You can absolutely do it. I think they said, Annie said you use the blue line basically, and you just hook your nasal cannula up to the blue line, and then you don't use the white line at all. So that is possible too, but that's something that we're going to kind of work at as we go. we are all learning this together, like the physicians, all the providers, the nurses, and us. We're all kind of learning as we go, and things may change. The equipment we use may change, the way we do it may change, how we transfer between CPAP to high flow to regular nasal cannula, how we wean, all that stuff may change. But we want to be able to offer this so that people can stay here with their little ones and not drive to Seattle because they need 12 hours of CPAP.
So this CPAP considered to be more upscale care than high flow.
Yes,
For
it is.
us.
It is a higher level of care. Yes.
Okay.
Well, you said you can transition from from bubble CPAP to high flow.
Yes.
Do you change any of the settings?
No, you don't. Well, I would go down on your liter flow. Like your physician may say, go from 5 of CPAP to 3 liters
Right.
high flow.
Yeah.
3 liters at 30%, and let's see if that works.
Mm-hmm.
In that case, I would hook up a regular nasal cannula
Mm-hmm.
to this, turn it up to 3 liters,
Right.
plug it into the baby, and
Yes.
see if it works. If it works,
Mm-hmm.
and we want to keep the baby on for a couple more hours or longer, then we can switch this to the heated high flow
Right.
setup.
Right. Okay.
go ahead
Okay.
And hook the high flow nasal cannula into this piece and go ahead and try from there.
So this one is for the high flow and this one is for the CPAP.
Yes. Yes. This one will always stay on 8 liters. This one will probably not get turned on unless you're weaning a baby that you want to try to transition. You may have a provider have a kid on 5 of CPAP at 21%, and they might say, just take them off to room air. Just take them off. They're on room air. They're
Mm-hmm.
getting 5 of CPAP, but I think this kid's good. Let's just take them off.
Mm-hmm.
So you can also do that. Just take them off. So
And this one goes only to 3.5.
3.5. Yep. If you wanted to put the baby on high flow of 5,
Mm-hmm.
say you start out CPAP of 5, 21%, and they say let's do room air. You do room air, and they go, whoa, nope, the kid's tanking. So you put them back on CPAP for a little while. Then they say, okay, that didn't work. Let's put them on high flow of 3 liters. So you can you adjust this up to 3 liters,
Mm-hmm.
put them on the nasal cannula,
Mhm.
see how that works. If that's not enough flow, you can always switch over to this side, and you could go up to 5 or 6 or 7. You know, we don't want to go any higher than 8 on an infant with high flow anyway. So
Okay.
okay.
Got
Any
it.
questions?